Welcome back to Jersey Matters. It's always a relief when you leave the hospital after a stay or an operation, but that relief ends when you get your first bill and you find out there's some things insurance isn't covering. The American Heart Association is leading a national charge to get rid of surprise medical bills. Here's my interview with the president of the American Heart Association, Dr. Mitchell Elkind. Doctor, thanks so much for having some time to talk to us. Let's talk about surprise medical cost. I think that a lot of people don't know what it is until it's too late, until they're a victim of them, until they get a surprise medical cost. Explain what they are.
Sure. Well, thank you for having me, first of all. Yeah, so a surprise medical bill is when you get a bill for a medical procedure or care that you thought was covered, but in fact wasn't. So, for example, it could be that you go to the hospital and the doctor who's called to see you isn't on your insurance plan, and so insurance doesn't cover it, and you end up having to foot the bill. Or if you end up going to the emergency room, it could be that the transport that brought you there ends up sending you a bill again that's not covered by insurance. So that would be the idea, and obviously that can cost a lot of money to patients.
Does it happen often?
It happens quite a bit, actually. In fact, about 60% of Americans who are insured have gotten surprise medical bills. And I think there are about 10,000 of those occurring per day. So it's quite a common phenomenon.
And these bills can be exorbitant.
They can be. I mean, the average cost is about $600 or so, which can be a lot of money for many people, obviously. But sometimes the cost can go way above that. Certain transport costs, like imagine an air ambulance, right, where a helicopter brings you to the hospital in a serious emergency, that can cost $30,000. And again, insurance may not cover it. So I think also right now, obviously, we're going through the coronavirus pandemic, and that just exacerbates this problem because people may discover that they can't, for whatever reason, they can't go to their local hospital. That hospital may be full. They may have to go to another hospital. They may have difficulty reaching their primary care doctor and have to see somebody who they don't even realize is out of network. And so all of those issues really make it a much bigger problem, I think, than any one single state can address.
It's interesting you brought up the pandemic. I was going to ask you about that. What particular type of out-of-network bills are showing up? Are there any that didn't show up in the past that are just specific to the pandemic?
Well, one obvious one, of course, is testing, right? So testing for the coronavirus itself. So some people are getting bills for that they would have thought would have been covered. So that would be the most obvious one. But of course, also when people are hospitalized with COVID, they can become quite ill. They need to be in intensive care units. They may need advanced medical procedures. And that can often involve a lot of consultants. And when you're in the hospital, your own doctor may be on your plan. You may be aware of that and feel comfortable with that. But other doctors who get called in, various specialists, for example, may not be on your plan. Just because your doctor is doesn't mean that the other doctors in a hospital will be. And so that's where surprise billing can become an issue because you might get a bill from one of these other physicians for their care. And so again, very sick patients are going to tend to see this even more often than people who arrange everything ahead of time for an elective procedure.
And the American Heart Association is involved, obviously, because this is a specific problem for people who have heart disease or suffer heart problems.
Well, that's right. And the American Heart Association is really devoted to the well-being and health of all Americans. And that goes beyond just heart disease. For one thing, it includes stroke and other cardiovascular problems. And I wouldn't say that this is a specific problem for those conditions, but it's certainly a very big problem for those with cardiovascular disease. They may be disproportionately affected by the issues around surprise medical billing, again, because of the emergency nature of cardiovascular disease. Heart attacks and strokes can lead people to come to the emergency room and have those sorts of expensive transport costs. And again, they may need many consultants to be involved. And we really don't want people to become fearful of calling 911 or going to the hospital when they have a heart attack or a stroke, because that's the care they need. So we don't want financial costs to get in the way of the best possible care.
I remember when they were trying to push the bill through in New Jersey, and they hit some headwind, not only from insurance companies, but from physicians and from hospitals who were fighting this bill. Is that the kind of pushback that they're getting in Washington on this bill?
I think that's the case. There's a lot of different groups who might be interested in not having legislation to prevent this, and that could be those people who are getting paid by the medical, for the medical care in the first place. So yeah, there is some resistance to it. But again, I think the American public, those of us who need care, and that's going to be the vast majority of Americans, are very supportive of this legislation. If you think about it logically, there's something fundamentally incorrect about the idea that when you're faced with a life-threatening emergency, that you get medical care, and then the costs of that, again, devastate you financially.
Especially when you think you're covered for it. You think you're covered and you're not covered.
Exactly.
That's horrible. And I guess maybe the headwind we were talking about, and the people on the other side of this, is one of the reasons you've been working at this for a couple of years now. And are you close?
We're getting closer, I think, but there's certainly more work to be done, and we encourage people who are interested in this issue to get involved and advocate. First of all, educate themselves. They can learn more about it at our website, heart.org/surprisebilling, for one thing. And if people have been experiencing this, as many people are, we encourage them to tell their stories, and they can even use the hashtag #IWasBilled as a hashtag related to this, just to let others know that there's a lot of people out there who are experiencing this problem.
I don't think sometimes people don't realize how powerful that can be, and especially just a phone call to their congressman can be extremely powerful, and social media has a power too. So that was good advice. Doctor, thank you so much for spending time. That was Dr. Mitchell Elkind, president of the American Heart Association. Still to come, calling attention to the epidemic of police suicides. That's when Jersey Matters continues.